Right now, hope hanging on the promise of vaccines coming soon.
It's going to be tough, and we're going to do it, and we're going to do it right. And I think this is going to be a new spring for Connecticut and our country.
And tonight at 6 o'clock, we have breaking news on the vaccine front.
Within the past 25 minutes or so, a key FDA panel approved the Pfizer vaccine for emergency use. Now, the late vote comes after the panel spent all day meeting on the vaccine. The FDA has said it will consider the panel's recommendation, and the commissioner has already signaled strong support, saying he has complete confidence.
Channel 3 Eyewitness News reporter Mike Savino spoke with medical providers about what happens next. He is live outside of Hartford Hospital with those details. Mike.
Well, Mark and Aaron, of course, the big question with what happens next is when will we have that vaccine here in Connecticut? Well, expectation is that the CDC will be able to start shipping those vaccines within 24 hours of that final approval. Here at Hartford Hospital and other hospitals and pharmacies around Connecticut say they are already ready to start receiving those shipments. And from there, we can start seeing doses within days for frontline medical workers.
Here at Hartford Healthcare, we'll be prepared and ready to receive the vaccine as early as Friday. That would probably be the first day that it would be approved for emergency use.
Hartford Hospital saying it's ready to receive doses of the coronavirus as soon as they're shipped. Other hospitals are in the same position. Trinity Health of New England saying in a statement today, "We've made all the necessary preparations to begin administering the vaccine and will do so as soon as we receive the required approvals of the vaccine, which could be as early as the end of this week. That means doses can be administered as early as next week, first to the medical workers tasked with giving the vaccines to everyone else. The UConn School of Pharmacy is stepping up to help. Its 350 students being among the people to give the first round of doses.
We feel it's an obligation that we assist them in immunizing the frontline healthcare workers within their facilities first.
Pharmacies will also play a major role in distributing the vaccines, taking some of the burden off of doctors and hospitals and giving the public more access. A spokeswoman for Walgreens saying today, Walgreens has the pharmacist expertise, data and reporting infrastructure, cold storage capacity, and nationwide footprint required to manage the complexities of administering a COVID-19 vaccine.
Pharmacists are some of the most accessible healthcare providers within our community.
CVS, meanwhile, announced earlier this fall that it will hire another 15,000 workers nationwide, the majority of them pharmacy technicians. For pharmacists, this is an opportunity to show the value they play in the healthcare industry.
One of the things I've always strongly felt is that pharmacists are some of the most underutilized healthcare professionals out there.
And UConn School of Pharmacy is helping out in other ways. They've already been offering a class for pharmacists to get certified to administer vaccines. Also, their students have been helping with contact tracing during the pandemic. Live from Hartford, Mike Savino, Channel 3 Eyewitness News.